Welcome back, welcome back, welcome back to science. All right, in chapter 22, section A, we're going to talk about birth control. So, birth control is whenever you're deciding to not reproduce. This is going to require some type of contraceptive, and that is to avoid fertilization, following intercourse, or to prevent implantation. There are several different methods of contraception that exist. The effectiveness varies greatly. One of them is called interruptus. Coitus is the Latin name for intercourse, so this is translates into the interruption of intercourse. This is the practice of withdrawing the penis from the vagina before ejaculation, preventing sperm cells from entry into the female reproductive tract. And it's not very effective because you have sperm cells that are released before ejaculation. You have the most amount that are going to be at ejaculation. However, you still have sperm cells that are released before, which means it could be problematic with fertilization occurring um, before then. Another method is called the rhythm method. The rhythm method is going to require abstinence, which means not having sex, from sexual intercourse 2 days before and 1 day after ovulation. There are different ways of doing this, including thermometers to measure a person's body temperature. This also is not very effective. Since it's difficult to predict the exact time of ovulation, it's hard to pick which 2 days, which 3 day window needs to be the abstinence window. All right, mechanical barriers. This is preventing sperm from entering the female reproductive tract during sexual intercourse. These are condoms. Male and female condoms are used for this. There's also chemical barriers, where you're using different kinds of creams, foams, and jellies. These are the most effective when used with a mechanical barrier. So, if you're using a foam, cream, or jelly with a condom, male or female, this would reduce the odds of conception greatest. All right, combined hormone contraceptives. This is what most people are probably thinking of when they think about contraceptives. This is delivery of both estrogen and progesterone to prevent pregnancy. These contain synthetic chemicals that function like estrogen and progesterone. And if you remember the hormones as you're increasing large amounts, you have an increase of estrogen and progesterone after ovulation. And so by taking estrogen and progesterone combination, which is what you call the pill, this causes the body to think that it has already ovulated. So it doesn't work on maturing a cell utilizing FSH and LH. So that follicle maturation and ovulation never happens. So with that, there's no egg that's released for a person to actually conceive. Another thing that occurs whenever you take estrogen and progesterone pill, or really there's different forms than a pill, but let's just, the pill is probably the one that's been around the longest. You're going to have a thickened cervical mucus. This mucus itself is going to prevent sperm from being able to cross through the cervix, get into the uterus, go up the uterine tube where it will fertilize that egg that has been ovulated. So, in essence, um, we have other hormone contraceptives like an intramuscular injection of medroxyprogesterone acetate. This protects against pregnancy for 3 months. It prevents maturation and release of a secondary oocyte. Another device is called an intrauterine device. This is an IUD. This is a small, solid object implanted into the uterine cavity. It's going to kind of look like a T, and it's going to have strings that are coming off of it. This causes inflammation that is toxic to sperm and oocytes and prevents pregnancy. Some of these are going to use copper, as you could see here in this one. So here we have a male condom, female condom. We have some of the and foams that are released here. And here we have the typical pill count that was really common when I was younger. This is what people were on the pill was really the only one that people talked about taking for contraceptive. All right. So emergency contraception. The morning after pill can be taken from 3 to 5 days after intercourse. This works by preventing ovulation. It prevents pregnancy but does not work if ovulation has already occurred. So there has to be a very short window of where this actually can work. The other processes of birth control methods include things like sterilization, like a vasectomy in males. This is a permanent procedure where they take the vas deferens, also called the ductus deferens, the tube going from the testy, epididymis, then you have the ductus deferens that's going to go to the urethra. You're going to take that tube and you're going to cut it, and you're going to stop it. Um, the procedures that I've seen done are going to put a type of hemostatic clip that's going to close off each vessel, and then they're going to cauterize between it, which means they're going to burn it with electricity that's going to keep these tubes from navigating to each other just in the wrong scenario, the wrong time, to where they could reunite and have a continuous, let's say the clips came off. It would take so many scenarios for this to work out, but that's just part of the procedure that I'm familiar with. Is you clamp each of the ductus deferens, and they take that tube that they've taken out, and they send that to pathology to verify, like, yes, that is the ductus deferens, because it has a certain kind of tissue that's distinguishable, instead of like taking out the wrong thing. It's just another step of that process. So this prevents sperm from ever leaving the epididymis. It doesn't really change the volume of the quantity of ejaculant much, but you don't have the sperm cells there that you typically would. So you would still have semen, you just don't have sperm cells in that semen. Now, on the female side of things, you have something called a tubal ligation. A tubal ligation is where you have your tubes tied. And they don't really tie the tubes. They're going to put a type of hemostatic clip, but they're going to cut the tube, they're going to clamp on each side. They're also going to go through the same type procedures. The whole purpose here is to prevent the sperm cells from traveling any further than that clipped spot. At that point, sperm don't go any farther. Therefore, you don't have any sperm that can reach an egg cell to actually have fertilization. Here is the vas deferens that is separated and tied, and they're just showing string right here to tie it. Here's a tubal ligation. They're folding it over and showing string tying it. It's the procedures that I've been part of. I've seen a lot of vasectomies in my medical career, and all of those, there was no stitch that was involved in any of this. So I assume the same is going to be in women as well. So this is the chart talking about birth control methods. So this is the number of pregnancies per 100 women. So method is like a barrier and a spermicide. So you can see the effectiveness of these, and very few pregnancies with vasectomies, tubal ligations, interuterine devices. So it's pretty rare. None of these are 100%. And even abstinence has one success case, and um, you'll talk about him come Christmas. All right, guys. We'll talk about STDs next. I'll see you soon.